A mind-body symptom is a symptom that is caused by the brain. It can be a real physical symptom that is in the body, or it can be an emotional symptom. Because the brain exerts control over every organ and every tissue in the body, really any symptom can be a mind-body symptom. And you can have more than one mind-body symptom, which we call a mind-body syndrome. Of course, not every symptom is a mind-body symptom. You can have disease or dysfunction in any tissue or organ in the body. In that case, your doctor or medical provider will usually find abnormal results on blood tests or other tests they may perform. So let's start with some examples of things that are not mind-body syndromes. Cancer is not regarded as a mind-body syndrome. For instance, if you have pain in your back due to a tumor in your spine, that is not mind-body. You should speak to a cancer specialist, and you may need chemotherapy or radiation or surgery. I do not recommend psychotherapy or complementary alternative treatments like mindfulness as the primary treatment option for cancer. Although it may surprise you to learn that the brain and emotions do play a role in the experience of cancer. And so I would recommend psychotherapy as a secondary treatment option if you are diagnosed with cancer. Autoimmune diseases are not regarded as mind-body syndromes. Autoimmune diseases include things like lupus, rheumatoid arthritis, and inflammatory bowel disease like ulcerative colitis or Crohn's disease. People with these autoimmune diseases have abnormal laboratory tests, or other tests are abnormal, such as biopsies. And autoimmune diseases are treated with medications and sometimes surgery, not with mind-body approaches. Ongoing infections are not mind-body syndromes. For instance, somebody might have painful urination or painful sex due to a urinary tract infection. Once the infection is treated, the symptoms then resolve. But if someone has prolonged symptoms after the infection has passed or after the infection has been treated with antibiotics, then this may very well be a mind-body syndrome. If someone has pain that is due to a fracture of a bone, then obviously this is not mind-body, and the fracture should be treated with immobilization, like a cast, or sometimes surgery. Finally, some people may have a rare genetic disease that causes pain or other symptoms, but these are rare, and there are usually some clues that a genetic disease is present. For instance, there may be abnormal lab values, blood tests, or other tests that your medical provider may perform. In addition, there's usually what we call a family history of the disease, which means at least one other family member also has some symptoms of the disease. And finally, genetic diseases tend to be starting earlier in life. So a symptom that comes on in adulthood is unlikely to be caused by a genetic disease. What are some examples of mind-body syndromes? Many chronic pain conditions are mind-body syndromes. Recent research shows that at least 85% of back pain is mind-body. What happens is that neural pathways in the brain send output down through the nervous system that causes the back muscles to be chronically tensed up, leading to pain. Other chronic pain conditions, such as neck pain, limb pain in the arm or the leg, or tension headaches or migraine headaches even, can be mind-body syndromes. Phantom limb pain, which is pain that's felt in a part of the body that has been amputated, is a powerful example of how the brain can create pain symptoms. Fibromyalgia is yet another painful mind-body syndrome. Some doctors may tell you that fibromyalgia is medically unexplained, that the cause is unknown, but that's simply not the case. We have found in our research group that we can completely resolve many cases of fibromyalgia using a mind-body psychotherapy program, such as emotional awareness and expression therapy, or EAET. Chronic symptoms in the gut or the GI tract can also be mind-body. These include things like chronic constipation, chronic diarrhea, nausea, bloating, stomach pains, things like chronic vomiting or rumination syndrome can all be mind-body. People with these symptoms sometimes get a diagnosis of irritable bowel syndrome, which is one of those other things that doctors may say are medically unexplained. But through psychotherapy, we can discover how stress and the way of handling their emotions has contributed to changes in neural pathways that lead to the symptoms. Irritable bladder symptoms like pain or discomfort on urination can also be mind-body symptoms once infection is ruled out. And sexual symptoms like erectile dysfunction or premature ejaculation or pain during sex can also be mind-body symptoms caused by neural pathways in the brain. Finally, many psychiatric disorders are mind-body syndromes. This includes depression, anxiety, and post-traumatic stress disorder. 99% of the time, they are caused by neural pathways in the brain. Very rarely, depression may be caused by something like a problem in the thyroid, hypothyroidism, but usually, again, they are caused by neural pathways in the brain, just like many other physical symptoms that we have discussed. I hope this gives you a good idea of the scope of mind-body symptoms and syndromes, what they are and what they are not. Now, just remember that every mind-body symptom I've discussed can have a cause in the body and sometimes a serious cause like cancer. So if you have a new symptom, it is important to go to your medical provider and get a full workup. Don't forget to like this video and subscribe to my channel so we can grow this community of people trying to understand the mind-body connection. Thank you.